My name's Kyle Wright. I'm a pre-physical therapy student in basic injury prevention class, and today we're going to be looking at a possible ACL sprain. This is Liz. She's going to be the patient. Hey Liz, how you doing today?
I kind of hurt.
Kind of hurt?
Yeah.
Oh, okay. Yeah, I noticed you were kind of limping when you came in.
Mm-hmm.
What were you doing when you hurt your knee?
Yes.
Okay. What were you doing when you hurt your knee?
I played basketball and I went up for a layup, and then when I came back down, I landed on my leg wrong and I just kind of like gave out on me and I fell.
Okay. So you said it kind of gave out?
Yeah.
Okay. So like it felt like kind of like you couldn't bear weight on it?
Yeah, there was like a big pop,
Okay.
and then like when I tried to walk, I couldn't walk right away. It took me a few seconds.
Okay.
And it just feels like my knee is like coming apart.
Okay. Gotcha. Yeah, it's kind of scary.
Mm-hmm.
How's it feeling today?
It's fine now. It still hurts really bad, and it's still like if I stand on it for a while, it just doesn't work, and I really
Gotcha.
can't extend it fully.
Okay. All right, I'm gonna kind of look at your knee here. I noticed it's kind of swollen here a little bit. Did it swelling? Did it swell? It probably got a lot more swollen throughout the day, right? Like after the injury. Okay. Did you end up finishing the game, or did you sit out?
I sat out.
Okay. All right. So you heard a noise. So yeah, this one's definitely like more swollen compared to this one. You're limping, so what I'm gonna do is just want to kind of feel around the different structures around your knee and see what I can see. Okay.
Mm-hmm.
Mind just scooting back a little bit. Kind of raise your knee up here. Cool. I'm gonna feel these. So you got two ligaments over here. Just want to make sure those aren't damaged. One on the medial side, one on the lateral side. The MCL and the LCL. Those feel good. A little bit of swelling here on the joint midline. The patella seems like it's intact. You got a little bit of pain here when I push on it?
Mm-hmm.
Okay, cool. Well, not cool, but. All right, everything seems to be in place. It's really hard to tell. I think it's more going to be around the joint line. The ACL possibly is what's going to damage you that, or the PCL. So what I'm going to do is I'm just going to perform a test now, okay, to see how much it gives way. So I'm just going to pull this anteriorly towards me. Yeah, see, you feel that like there's a little bit of play there?
Yeah.
Yeah, I think that you definitely have a minor tear, so a minor sprain basically on the ACL, which is the point of that is to keep that from sliding forward like that, right?
Mm-hmm.
So what we're gonna do is we're gonna go over a couple different exercises you can do.
Okay.
Okay. Just wanna lay down on your kind of diagonal.
There we go.
Perfect. All right. Just kind of put your leg as straight as possible. There you go. All right, so what you're gonna do, I'm gonna do it for you first.
Okay.
Come over here. These are called heel slides. Okay, so what you're gonna do is you're gonna slowly slide your foot towards your butt, okay? As far as you can go, and then slowly bring it back down. All right, why don't you try that?
Okay.
Perfect. Kind of feel like some tension back here on your
Yes.
hamstring. All right. So you can do that about two sets for 10 times. So 2 sets, 10 reps. Okay. And you can slowly bring that up. Then we're gonna do the next thing we're gonna do is called a quad set. All right. So you're gonna take like a towel or something like that. You're gonna place it right under the knee. All right. Just to kind of strengthen that, to help you extend more, strengthening these quad muscles. All right. So what you're gonna do is you're gonna bear down on this to like try to extend your knee all the way while keeping the heel in contact with the table. Okay. All right. You feel like some tension up here?
Yeah.
All right. You feel those contracting. You can do about 2 sets of 10 reps on that. All right. And then the other thing you're gonna do is called a knee prop. So you're gonna put the towel here, right under the ankle. And you're gonna try to, as best you can, to straighten your knee. All right. And just hold it for about 30 seconds to a minute per time. You can do that like 4 times throughout the day while you're watching TV or whatever. Start off with 30 seconds to a minute, and then as you get better at it, you can go to like 2 to 3 minutes. Okay.
Mm-hmm.
All right. And the last thing you're gonna do, I don't have like a strap or anything, but basically you're gonna try to stretch this hamstring out. Okay. So you're gonna lay back, and you're gonna take a towel or like a strap or a belt or something like that, and you're gonna wrap it around here, and you're just gonna pull that up and stretch the hamstring out.
Like this?
Yep. And just hold it. Yep. And then you're gonna bring it back down. Just hold it for about 30 seconds per time. And just do that a couple times a day as well. Okay?
Okay.
All right, perfect. Any questions at all?
Mm-hmm.
All right, awesome.